Welcome to my vlog! So going back, what I'm going to do is to make a quote-on video about the For today's video, our topic is kind of sensitive, as you have been warned in the beginning, because this has something to do with one of the worst impacts of having mental health problems. If you notice the warning sign symbol, then you know what it is. But before anything else, please subscribe to our YouTube channel, Monsod Youth, because we will be posting more videos about various community problems, and hopefully we could spread awareness as well as initiate change. So please hit that subscribe button. Going back, what I'm going to do is to make a quote-on video about the causes and symptoms of the said issue and discuss it afterwards.
Early life adversity is a major risk factor in developing behavioral and psychological problems later in life. Higher rates of depression, anxiety disorders, suicidality, post-traumatic stress disorder, and aggressive behavior have been reported experienced by adults who had maltreated in their childhood. As demonstrated by a review of the effects of perceived social isolation, loneliness can wreak havoc on an individual's physical, cognitive, and behavioral health. Grief is typically an emotional roller coaster, but sometimes this chronic grief can lead to development of mental health disorders like depression and, in rare cases, psychosis. The negative impact of grief in someone's life can cause them to engage in self-harm or suicidal actions. A certain amount of stress is normal in everyday life. However, long-term stress can be harmful. When it becomes overwhelming and prolonged, the risks of mental health problems and medical problems increase. Most prospective studies confirm that job loss and lack of long-term salaries can result to deterioration of mood and self-assessment with appearance of somatic and mental disorders. There are evidences that show drug and alcohol use may cause mental illness. For example, research shown that cannabis can increase your chances of developing schizophrenia. Abuse, whether physical, emotional, or verbal, can have long-term effects in your mental health. Trauma can affect how you feel about yourself and how you relate to others. Women who have gone through abuse and had trauma have higher risk of developing post-traumatic stress disorder, depression, and anxiety. Mental disorders are the result of both genetic and environmental factors. Consequently, it is difficult for doctors to determine the risks of person's inheritance of mental disorder or passing it on their children. The chemical imbalance theory is unproven yet often cited as an explanation of having mental health disorders. For example, depression is said to be a result of too little serotonin in the brain. Most common evidence to support this theory is the use of antidepressant because it becomes effective. The intake of chemicals by pregnant women can affect the baby inside them. If exposed to large quantities of toxic chemicals, it is possible for the child to develop future health problems. Being diagnosed of a chronic illness produces myriad of intense feelings and emotions. Everything from exhaustion to guilt to resentment because the demands of the family and friends. Dramatic sleep and appetite changes or decline in personal care. Rapid or dramatic shifts in emotions or depressed feelings. Recent social withdrawal and loss of interest in activities that once enjoyed. An unusual drop in functioning in school, at work, or in any social activities. Problems with concentration, memory or logical thought, and speech that are hard to explain. Heightened sensitivities in sights, smell, touch, or avoidance of overstimulating situations. Loss of initiative or desire to participate in any activity. A vague feeling of disconnected to oneself or one's surrounding, a sense of unreality. Illogical or magical type of thinking of a childhood in an adult. Fear or suspiciousness to others, or the strong nervous feeling. Old, uncharacteristic, and peculiar behavior.